Hi, I'm Rob Phillips. I'm part of the human resource team here at Gartner, and today I've got a guest with us. His name is Pete Sweetnam. Pete, thank you so much for joining us today.
I'm very happy to be here.
Now, Pete, a lot of the Gartner associates don't know too much about the Merlin organization. Could you spend a couple minutes and just give us a little bit of background on the organization?
Certainly. We're a global organisation concentrating on delivering health services to about 17 countries around the world, from Afghanistan to the Congo, from the Central African Republic, and now including Haiti following the disastrous earthquake of January the 12th. I have the title of Director of New Initiatives and Response, and so in terms of Haiti, I'm the director in charge of the response there, and I've just returned from Haiti.
Could you give us a little bit of a feel for what that was like?
We were a very early responder, despite not having a program there to start with. We inserted a dedicated surgical team, a specialist surgical team, plastic surgery, where we involved in what's called limb salvaging, which is specialist surgery where people who normal orthopedic surgeons can't deal with, the crush injuries and so on, which are so prevalent post-earthquake, and we're still actually seeing happening now. So we've flown in about 30 tons of supplies. We have set up a twin operating theatre tented hospital with about a 40-bed inpatient unit. Post-operative care is very important there. Lots of people from other hospitals are being discharged to the street or to homes which are destroyed, and so there's lots of post-operative infections. Again, that's something which requires or can require specialist surgery to address.
Sure. No, thank you for that. And then specifically, as Gartner, the corporation, made a donation, can you tell us a little bit about how that money was applied and how that worked?
Yeah, that would have been used to buy some of that 30 tons of supplies, and everything has to go in, from the operating tables to the x-ray machines to the small pieces of equipment to help with skin grafting and so on. So there's a whole range of anything you take for granted when you go to visit your doctor or go to a hospital. We have to fly in. We have to service. So we're still flying in more gases for the anesthesiology, more specialist pieces of equipment as they become needed. We're also, because we need to take surgeons, dedicated surgeons who are actually working still at the peak of their job, we are rotating teams quite rapidly. So we're bringing them out of the National Health Service in the UK for 2 to 3 weeks. They will fly in as a team and operate as a team. So we have pre-operative care, anesthesiology, orthopedic surgeons, specialist plastic surgeons, scrub nurses, theatre nurses, and post-operative care people all in there. And that's now being more and more supplemented or added to by Haitian health professionals.
Okay. So, and I know it's been a really difficult couple of weeks. Are there any kind of success stories that come to mind that you could share with us that your organization has seen with all the work that they've done?
It never ceases to amaze me that no matter how difficult things may be, how disastrous and how touched people have been, people have within themselves the capacity to build. And you see that time and time again, particularly with the children. I mean, we have done what would be quite horrific operations for some children. They've had arms amputated, hands amputated, but they bounce around. And there's one little girl who, just 24 hours after her hand was amputated, was entertaining everybody with dance routines, whether they wanted to entertain them or not, as kids will. I mean, even though from the outside the television pictures can make it feel desperate, there is within that situation very real human resilience and human hope.
Thanks for sharing a few of those stories with us. And, you know, we applaud you for the work that you're doing and really thank you from the bottom of our hearts, because we know that the donations are really going to really help people and I think have a real impact on a country that needs help in a big way. So thank you.
Thank you.